Hi, my name is Ms. Mariquin, and I am the CTE Sports Medicine Pathway teacher here at Southwest High School. The Sports Medicine Pathway includes 3 levels. Each level is 1 full year or 2 full semesters. Sports Medicine 1 is where students begin. In Sports Medicine 1, we cover topics such as sports medicine careers, where we would learn about careers that fall under sports medicine. We would learn medical terms, medical terminology. We will learn about the body systems in regard to how they work with movement and athletics. We will learn about tissue response, or how our body responds to when it's injured. We would also learn about emergency procedures, or how to take care of injuries. And we would work on career development. We would work on creating a resume and creating a cover letter. In year 2, or Sports Medicine 2, we would go deeper. So Sports Medicine 1 is essentially our foundation that we're going to build upon moving forward. In Sports Medicine 2, we go deeper into the muscular and skeletal systems of the body, and we learn how to evaluate injuries, how to manually test in muscles and determine what the injury is, and we learn how to prescribe rehabilitation programs. In year 3, we work on advanced topics. We are changing the curriculum a little bit in Sports Medicine 3, but essentially we are going to go deeper into what we already learned in 1 and 2 and add some more complex topics as well. So let's talk about completing the pathway. The pathway, I'm going to jump to the bottom here. To complete the pathway, you only need to complete 2 years. You only need to complete Sports Medicine 1 and 2 in that order, all 4 semesters. The 3rd year of sports medicine, or the 3rd level, is completely optional. If a student does complete 2 full years in order, Sports Medicine 1 and then Sports Medicine 2, and the student does earn A's and B's, they could potentially earn college credit. And the student will also receive a SOH for graduation for completing the CTE Sports Medicine Pathway. Some extra perks in regards to CTE Sports Medicine. There's some hands-on experience. In class, we will practice what we're learning. So when we're talking about injury evaluation or talking about creating rehabilitation programs, we're going to actually do those in class with the tools we have and with our partners. There's also an opportunity to shadow the athletic trainer. I am also the athletic trainer at Southwest High School, where I go to home varsity events and I cover them as an certified athletic trainer. And students are able to volunteer and shadow and work along with me to learn about what we're doing in class, applying it to real life situations, while also learning things like paperwork and other administrative duties that go along with some careers. Another chance students can do some hands-on experience is doing observations at our district clinic. So our district does have a clinic that we can send student athletes to get further evaluations. And we're able to get some students in there to shadow physical therapy students and doctors that come and volunteer their time to work with our student athletes. Some other extra perks that we have, there are some certifications that we do complete along the way. Just to name a few, we have first aid certification and CPR certification. Keep in mind that these certifications are something that we would do later in sports medicine in the 2nd or 3rd year of the program. There are some other certifications that were in the works to adding as well. So I like to conclude with this quote: if you take care of your body, it will take care of you. And in this course, all 3 levels, I really like to take the time to go over the material so students not only know how to work in the medical field, but also how they can respect and learn about their body. If we can take the time to learn about our muscles, our bones, and how they work when we move and what happens when we're injured, and we can learn what type of movement should we do when it's injured, we can take better care of our bodies. And then in turn, we'll be able to live a more healthier life and continue any movement that we choose to. So if you're interested in sports medicine, I am very happy to hear that. And thank you for your time.